incontinence. Who would have thought that PT might be able to help with this? You don't think of that because that's kind of internal.
I know, but
Yeah,
it's
but it's a
controlled by
muscle.
muscles.
Exactly,
Right.
exactly.
So physical therapy absolutely can help with incontinence.
Yep. But I think the one thing we want to say is, I think as soon as people think incontinence, you're probably already doing it. It's just everybody starts squeezing and doing their Kegels exercise, where you tighten your vaginal muscles and your buttocks muscles. But the reality is that's not enough. There's different kinds of incontinence: urge, stress, mixed, and some people may not need the squeezing. What they may need is to learn when to squeeze, when to relax, so that they can work on the incontinence. And there are good studies that show if you get on a good program, it will make a huge difference. So that would be my suggestion.
Yeah, and I think recognizing it and talking to your healthcare provider about it, and it's not an uncommon thing, so don't feel uncomfortable talking about incontinence. And then there are pelvic floor specialists who are physical therapists trained to diagnose and treat, and just like Carol said, recognize when you need to strengthen, when you need to relax. Maybe it's a timing issue, rather than just Kegel, because that might not be the right thing for you.
Right.
And then also recognizing it's not just in females. Males have incontinence too.
Yep.
So, and pelvic floor specialists treat both men and women. Right. So if this is something that you are struggling with or curious about or feel like you can benefit from, do seek help from a pelvic floor specialist who's a physical therapist.
I agree.
Yeah.